Despite the endless threats of being fired, healthcare workers continued with their strike, demanding their employers to act responsibly if at all they were to resume work. For the second week running, health workers in Mombasa abandoned hospitals and took their case to the streets.
He can continue threatening us, he can do what he thinks is right for him, but there is law that protects these healthcare workers.
Who are they going to employ if they cannot pay even those few they have been able to recruit?
According to Mutai Kagwe, such delays are as a result of the delay by the exchequer, as counties have been relying on bank overdrafts to ensure smooth running of services. And while he admits that is an issue, he insists that is not the case for other grievances brought forth by the healthcare workers.
No county to date has come to the Ministry of Health and said that they have either asked workers to go without PPEs or indeed told us that they have run out of PPEs without us supporting in terms of replacements and additional PPEs.
Given that health remains a devolved function, Mutai has warned the medical unions to be county-specific while raising their issues, as most counties have addressed promotion and insurance matters for their workers.
The Council of Governors has confirmed that all counties have designated specific health facilities to treat all counties, to treat all workers, all health workers and their dependents. Some counties have even made arrangements with private sector facilities for this. Unions are encouraged to reach out to the county departments of health to guide on the designated facilities in the respective counties.
Healthcare workers have been demanding for an enhanced risk allowance following the halt of the COVID-19 allowance they were being given for the first 3 months since the virus hit the country. However, that plea seemingly appears to be a pipe dream.
A bonus given on the basis of goodwill and as a thank you by the President of the Republic of Kenya to our health workers is now being demanded to be a permanent feature. And it's difficult to fathom this. It's akin to somebody giving you a Christmas present and then you demand that Christmas present must now be given to you every day.
With the strike being on its second week, despite the doctors having downed their tools for just 2 days, the county government has issued a raft of measures to be taken against healthcare workers engaged in the strike. The COG advises that salaries of employees who have not rendered their services, as well as those who are engaged in postgraduate training at the national referral hospitals, be effectively stopped. Additionally, advertisement for the positions where employees have abdicated their responsibilities be started.
Both levels of government have tried their best, and we were still in the process of conciliation, which process has not been finalized. So according to the labor laws, what they have done is not right.
With no middle ground yet between the government and healthcare workers, the ministry has asked the parliament and county assemblies to give the executive arm of the government an opportunity to manage employee relations. This to help create a conducive environment that will allow focus on the fight against the pandemic for the sake of all Kenyans. Raquel Muigai, Citizen TV.